begin with the Ebola scare, news that we first brought you this afternoon.
A doctor who traveled to West Africa to treat Ebola patients alerted authorities this morning that he may have been showing signs of the virus. We have team coverage, including CBS 2's Lou Young at the doctor's apartment in Hamilton Heights. But we begin with Marcia Kramer at Bellevue Hospital. Marcia.
Well, Maurice, right now this is being treated as a case of possible Ebola. Sources are telling me that they're waiting to get the results of blood tests. Now, if they're positive, they should know within hours. But sources are also telling me that whether they're positive or negative, they're going to be sent to the Centers for Disease Control in Atlanta for confirmation. It's what could be the first case of Ebola in New York City. A doctor in his 30s working in Guinea with Ebola patients through Doctors Without Borders brought to Bellevue Hospital with full hazmat and contamination procedures in place. Sources say Dr. Craig Spencer had a fever and complained of abdominal pain. He had been in New York City for about a week. Sources tell CBS 2 the doctor, working in what was described as the prime zone for Ebola, called the city health department to alert them. 2 fully equipped hazmat ambulances were dispatched to his Hamilton Heights apartment. The ambulance drivers were fully outfitted in F-suits, level D hazmat suits covering their entire bodies. They stayed with the patient in the back of the ambulance, sources said, so as not to risk possible contamination of the front cabin. A third EMS medic drove to Bellevue. The patient was brought to Bellevue, one of 8 hospitals in New York with full isolation facilities. These pictures show there was controlled access and an airtight room. Doctors and nurses will treat the man wearing gear like this. Patient waste will be especially handled to prevent contamination. Now, the preliminary tests are expected to take 6 to 8 hours. They're needed to rule out other diseases like salmonella, malaria, and stomach flu. Now, as a precaution, the health department is sending out some people that they're calling disease detectives. Right now, what they're going to do is try to trace all of Dr. Spencer's contacts as a precaution to identify anybody that may be at potential risk. Right now, we're live at Bellevue Hospital. I'm Marcia Kramer, CBS 2 News.
Okay.